I want to show in this video a brief overview of how we would manage patients' self-administration of medication. To do that, what we need to do is we need to access the patient's medication administration chart, and I'm working from the clinical indicators view, which is the preferred view for each ward. And I'm going to go into the meds administration chart via this icon here. You are able to access meds administration from the overview, which is the icon that looks slightly different. It's got a bit of a colourful clock and a bell, and a pill if these are due. These are overdue, and this isn't due nor overdue. And you can also access it from your medication administration tab here, but I'm going to go from the clinical indicators overview. So this is my patient I'm going to be dealing with today, and I'm going to access meds administration via this icon. Now, a couple of things to note. Firstly, this pop-up is just one of the pop-ups that Lorenzo offers around that the prescription needs a review. Some antibiotics or antivirals have a review status on there for every 2 days. So if you do see this in the real Lorenzo arena on your ward, it's prudent just to have a conversation with the prescriber to say that these need a review. They do also get this message as well when they access the ePMA area of Lorenzo. So other things to note: this is a test patient. Please don't judge me on all of these prescriptions that have been prescribed for this 3-year-old. I know it's not all clinically appropriate, and there's been a lot of alerts generated when we've actually prescribed these for somebody of that stature. So in terms of medication administration or self-medication administration, it's quite different to ICM, but once you understand how the processes work, it is very simple. For instance, this enoxaparin I wouldn't expect the patient to administer. I'm going to go in here, I'm going to click on this overdue icon. I'm quite a few hours overdue, and I'm going to select that I've given this to the patient. I'm going to click this box that says no witness available. It's something that I have in this test system, but it's not something that's available across the organisation. And I'm going to press OK. And with that, I've got a little tick to say it's been given, and a little L, meaning it's been late, and who gave it and how late that was. That was 4 hours and 8 minutes late. The ibuprofen, on the other hand, the overdue one at 6 o'clock here, I'm just going to say that this was actually self-administered. So this would be the self-administration where we're witnessing the patient take this medication rather than them taking it themselves unobserved. So the patient's taken this and informed us that they've taken it. So we click on self-administered there, and we retain this icon in the patient area. Now we can select patient and carer if we wish, which has now been populated with patient and carer here as who it's been administered by. If, for example, in the real live system that the parent or carer or somebody known to this patient has been added into the patient's related people area of Lorenzo, this will populate with a name and their relationship with the parent or carer. So for paediatric wards, or if somebody's assisting the patient, we can have a named individual here, and we say that they've administered it. And if we don't have that named individual, we just can tick parent and carer not listed, which will give us this. But in this scenario, I'm leaving it as the patient's administered this themselves. That's as much as the system needs. All the mandatory fields are completed, all the blue text. There is actually a witness here, so I can suggest that I've witnessed this from the patient, given it to themselves, but in this scenario I'm not going to do that. You can add some additional comments in if you wish, and you press OK. Now it's given us a little tick again, a little L, but a little symbol of a person, and if we hover the icon over it, says it's been self-administered. So this is a dose by dose self-administering. They might not administer the one at 8 AM in the morning, but they've certainly coded into the system, given them one themselves for the 6 o'clock dose, although I've been quite late at giving that or witnessing that. So you can do that for as many doses and items as you need to. However, if you are at a position, or the patient's at a position where they are taking ownership and administration of particular medicines, so let's for example look down this list, and I'm going to suggest that the patient does their own Foster inhaler and also does their own Actrapid insulin. So I don't want to be documenting this every day. The patient's very fully aware of this and has been using it for a period of time. What we can do here is at the bottom of the screen we can choose Manage Self-Administration, which will give us a list of all the active prescriptions that are on this patient's chart. We can just scroll down through this list and pick up the prescriptions. So there's an insulin Actrapid and there's the Foster. And by selecting those two, and if we press OK, this work list, the meds administration chart, will update. We'll notice that the two prescriptions that were quite close to each other somewhere here on the screen have vanished, but they've moved down towards the bottom of the screen, because as far as Lorenzo is concerned, we don't need this to be so intrusive towards the top of the screen because the patient's dealing with this themselves. And you'll see that there's a patient symbol here to suggest that the patient's self-administering, and every dose from that point of when we made this change, so around 10:15, every future dose has now got a little person symbol moving forward, and that will be for tomorrow, the day after, etc. If we do need to override that particular function, we can click in the box. Because I'm trying to administer something that's in tomorrow morning, it's quite a few hours in advance, we get this warning to say, "Are you sure you wish to continue? It's a bit too far in the future." I'm just going to press yes. We then normally get the warning that says this is being self-administered by the patient. Do you want to proceed? Again, you can override that, and then you can suggest that you've given it if you need to, and you can change this from self-administered to given. But I'm not going to do this in this scenario, but you can see that the patient's symbol there suggests that all of these future doses for these two prescriptions are indeed going to be managed by the patient. So you can reverse that by going back to self-administration and unticking those boxes. So then at the point of unticking it, the future doses will then revert back to standard administration. And leave that as it is, just press cancel. If you need to give the patient an aid memoir, something to work from, something to document on, we can go to the bottom of the screen here where it says print, and this is where we normally print the medication chart, the one that we'd normally send with a patient, maybe to a different ward or a non-Lorenzo ward or a non-Lorenzo area or a different hospital. And we can start date of the 15th of November, a couple of days ago, going on to the 21st of November. If we press next, and then we can just wait for the screen to open, press preview. You'll see that we get what looks like a meds administration chart. Again, this is what you'd normally use if you need to send the patient elsewhere that's not a Lorenzo area. And you can see that the normal drugs are on there, but as we flick through these pages, 7 of them, there we go. So there's our Actrapid, there's the prescription, there's the dose, there's the strength, there's the route. These are all the previous doses that are obviously not yet recorded. This was a test patient, so these have all been overdue. But you can see as of tomorrow morning, the patient self-administering all of these themselves. And we should also have the inhaler here as well, so you can see again these doses as of tomorrow morning and working into the future are self-administering. So you could print off pages 5 and 6, each one has its own header, each one's got all the details of the patient, and you can provide those 2 pages to the patient so that they can continue for the next few days administering this themselves, and you'll need to then look at printing this again once this particular prescription is ended. So by the 22nd of November, print another chart. Okay, again, what I did there was a preview, but in order to print, you press the local print and choose the printer that's attached to the machine that you're using. Then press finish, and it will just take you back to the meds administration chart. And if we press finish, we return back to the clinical indicators view, and then we can move on and do other things from this point.